One of the big barriers to genetic testing and genetic knowledge is fear, fear of the unknown, fear of healthcare discrimination or insurance discrimination, fear of the psychosocial implications. But most of it's fear of the unknown, because once you sit down with the patient and explain that there's federal and state laws to protect you, that the knowledge is only positive, where whatever comes out of the knowledge, positive or negative, there's useful information, the fear goes away pretty quickly. So I think it's fear born from ignorance. And again, not in a derogatory word, ignorance, just not knowing ignorance. So, but that is one of the biggest barriers we have. And to this day, it's still frustrating. And sometimes, despite our best efforts, we can explain till we're blue in the face. And some people will just say, I don't want to know. And that's okay. But what's not okay is when it affects your daughter or your sister or your family members, because I feel like you have a moral obligation to help fellow man and woman. Even if you don't like your sister or daughter or have a dysfunctional family, there's still no excuse not to offer yourself up for genetic testing if you are the one that's been identified at risk, so that others may benefit. I just simply feel like if a child is in the street and a car's coming their way, you have to help get that child out of the street so it doesn't get hit by a car. And the same thing with a family member that may have a genetic risk. You can't just stand by and do nothing and maybe let them get hit by the same cancer you do. So I feel very strongly that it's not a legal obligation, but I'm not ashamed to say that people have a moral and ethical obligation to help their family members and just get over some of the dysfunctionality. But we deal with that fairly frequently because of the fear. And I don't mean to say that people have mean intentions when they don't. I think it's just simply fear. They're paralyzed by fear, and it is our job to help them overcome that fear and do the right thing.
Did you know that not every breast cancer patient needs chemotherapy? In fact, today, there's a way to identify whether or not you'd benefit from that chemotherapy based on the biology of your tumor. To learn more about the Oncotype DX assay and how to discuss the results with your physician, just press this button.